Yaliwadat and welcome. My name is Ali Jawani, and I am the IHPA National President. On behalf of the IHPA team and the Aga Khan Health Board, we thank you for joining us today for IHPA Grand Rounds. Before we hear from our guest speaker, a little background on the IHPA. The Ismaili Health Professional Association was established in 1993 under the aegis of the Aga Khan Health Board. We have over 2,900 healthcare professionals in all disciplines. One of the key mandates of the IHPA is to foster and enhance networking. We organize local events to promote collaboration and professional development. We connect members with activities and service opportunities through newsletters, webinars, and social media. We have an active mentoring program through the IPMP, or the Ismaili Pre-Health Mentorship Program. Ismaili health professionals are able to become role models and inspire youth in our community. The IHPA promotes health and wellness within our Jamaat and through outreach activities. IHPA volunteers have worked at local healthcare centers for impoverished communities. They regularly staff wellness centers in Jamaat Ganas and other Jamaati events. IHPA members were given the unique opportunity to serve and care for the Jamaat at the Diamond Jubilee Mulakat and gave extraordinary service. The international portfolio of the Aga Khan Health Board has engaged over 50 IHPA volunteers around the world. The focus is on strengthening clinical services, education, and building research capacity. There are many opportunities for you to become involved in the IHPA. The IHPA database is the anchor to all of our opportunities, so we encourage you to register. You can have a substantial impact, meet Ismaili colleagues, and help strengthen our community. I want to thank all the people who made today possible, from our leadership team to our marketing teams, and of course, our guest speaker. We will be hosting grand rounds once per quarter, and if you miss it, we will have recordings of the previous webinars available online at akhb.theismailiusa.org. Today's webinar will be posted within a few days. Now about our guest speaker. Nermeen Valiani is a licensed professional counselor who has been practicing psychotherapy for over 7 years and is currently seeing clients in a private practice setting in Houston, Texas. Her mental health training comes from a wide range of experiences in partial hospitalization programs, academia, research, and working with diverse family groups. She specializes in providing mindfulness-based therapies for depression, anxiety, multicultural issues, difficult life transitions, and parenting challenges. She is trained in mindfulness-based cognitive therapy. She also provides mindfulness trainings for professionals and mindful parenting classes. A little bit of housekeeping. Questions, as you have them during this session, please feel free to ask them through the GoToWebinar interface in the question box as you see here. And now, let's hear from our guest speaker.
Yali Madat, everyone. Thank you. Thank you so much to Health Board and Social Welfare Board for this opportunity. And thank you to all the healthcare workers who shared their experiences with me to help me put this presentation together. I believe the well-being of healthcare workers and families, especially during this time, is crucial for all of us. And it impacts our community, and it impacts each individual family who is in the midst of working within the healthcare setting. And I know that as healthcare workers, if your cup is empty, then you're not able to care and give the proper care. So I hope that I can help you and your families get understanding about fear and anxiety during COVID, also to get understanding about the warning signs about stress, specifically vicarious trauma, which we're going to go into. And then I hope to give you tips on how you can fill your cup. So I hope to do all of these things in the presentation today. So let's start off by looking at why healthcare workers are at higher risk of mental health deterioration. So One of the reasons is that healthcare workers have a very strong sense of service. People in these roles tend to prioritize the needs of others. And they may be, during this time, feel this unrealistic responsibility for the lives of the patients. And then they, based off of that, they may dismiss their own care. And they may say things like, it's okay, I can put my self-care aside during this time. I'm just too busy to worry about this. This is a crisis. I just need to get through this. This is more important. I'll take care of myself after the crisis. So another thing is that there may be some stigma as well, right? Mental health stigma is everywhere, even in the healthcare setting. So there may be stigma about appearing weak. And because of this, healthcare workers may not be as aware of their own needs, or they may have difficulty identifying and acknowledging their own needs. And so this could, again, affect their ability to be able to care for themselves. Another reason is healthcare workers' mindset about how to handle stress. Now, we know that you have been through rigorous training and you're able to handle high stress situations. And so because of this, you, on a normal basis, are able to handle high stress situations. And even if there's burnout, you may not get to the point of that secondary stress trauma. But because of your ability to be able to handle high stress situations and this mindset, you're actually more vulnerable during this time. And why is that? Because there are more misperceptions. Because the pandemic is not a normal situation. This is not your everyday normal situation. This is traumatic. You're in the midst of trauma. So what are some of the misperceptions that you may have about your ability to handle stress, right? Stress won't affect me. I can do it alone. I must do it alone. I can't speak up about my feelings. It'll make me look weak. If I talk or share my difficult feelings, it may prevent me from thinking positive and doing my job. If I'm spiritual, positive, mentally strong, I'm not as susceptible to mental health deterioration. And this one I hear a lot. I am really good at separating and compartmentalizing my feelings. So, even if something is very traumatic, it will affect me, but I can compartmentalize and separate those things. And so it doesn't affect me negatively. And this is not true. Because again, it's not normal. This pandemic is different. You are dealing with stress on a daily basis, and it's a very specific type of stress, which I kind of want to delve into. You're working in crisis mode. You are on the front line, confronting the enemy every day. You're exhausted. You're sacrificing, risking your life, going into work daily, maybe working overtime, multiple shifts, way too many hours. Your resources are limited. Maybe you're constantly in fear of risking exposure and spreading it to your family. You're experiencing increased amounts of stress for longer than normal periods of time. And you may feel like your body is not your own because all you're thinking about is your patient or your family, right? And you're just so busy caring about your patients. This is very stressful. You're also carrying the moral and emotional burdens, right? Of having to make decisions, difficult decisions in times of limited resources. Who gets the testing? Who gets equipment? Are there enough beds? If there's not enough resources, how do we determine what needs to be done? You may even feel pressure to work if you're sick. You may also be holding the weight of seeing people in pain and suffering every day. Maybe you're holding that weight in your heart, or maybe you're grieving for all of your patients that are dying, or maybe you're grieving for a loss. Maybe you're having a really difficult time having to tell family members that they cannot see their loved ones at the end of their life. Maybe you're also isolating. I know some are staying in hotels to make sure that they don't spread it to their family. Maybe you've already gotten sick and you've had to quarantine, or maybe you're dreading that day when you do get sick and then you have to quarantine all by yourself. And then, of course, there's the constant anxiety and fear. So let me go a little bit into anxiety and fear, because by its nature and the unpredictable nature of the pandemic, there will be anxiety and fear. So fear is a response to a perceived or actual threat, and it's actually designed to put us into action, to motivate us to do something. And this helps us to survive. So in that way, it can be helpful. And anxiety, worry, and stress is how we respond to uncertainty or when things are unclear, which is the situation now. How long will this last? How long will I have to stay away from my family? How long am I going to be risking my health? How long until I get it? What's going to happen with the schools, with my kids, with childcare? So fear and anxiety are necessary and helpful, but there's also an emotional response. We also have to look at the emotional responses of being in this situation and feeling this anxiety and fear. So you might be feeling dread and anxiety around going to work. That's common. Feelings of hopelessness. You might be more emotional than usual, and that's okay. You might feel social discomfort, withdrawal. You might be irritable or on edge and tense all the time. You may have apathy, lack of interest or enthusiasm or concern for the things that you normally used to. You might have guilt for being alive, for surviving, for even doing small things that bring you joy, like maybe using your phone, or texting others and laughing about it. You might feel some guilt about that. You might be avoiding your own feelings and discomfort. And you might be feeling very helpless, and that's okay, because we're all feeling helpless. We can't prevent this infection. You might be feeling helpless because we can't manage the course of the infection. So it's okay to feel all of these feelings, and you're not alone. We're all having these feelings, and your colleagues feel the same way. But you must deal with these emotions, or they will become harmful. They will get to the state where they become panic-like feelings or behaviors. Or it's just so overwhelming and you're overwatching the distressing information that is being sent through social media and news, and that's making you feel numb. Or maybe you're ruminating over the future of the what ifs. And although doing all those things, you're starting to get closer and closer to being more and more susceptible to emotional trauma. So let's now talk about secondary traumatic stress. What is vicarious trauma? It is when you feel as though what's happening to the patient is happening to you or will happen to you. You are taking on their emotional trauma. And why does this happen? It's because you are responding to other people's trauma and you're witnessing their distress and their suffering over a long period of time. Now, why are you as healthcare workers more at risk for this? Well, there are first responder studies, many first responder studies that have been done. And from previous studies of crisis situations, we know that first responders, those who are dealing with the trauma of the crisis day in and day out, experience secondary trauma during it, and also could experience it months later. So we have to start to be aware of these warning signs, even family members, right? So that we can start to recognize some of these signs when we see them in our healthcare workers, so that we can take care of them. You are in the midst of dealing with this trauma. And because of that, it can shift your view of the world, your sense of safety, your level of trust, your beliefs about justice and understanding ourselves and others. It's kind of like when people go off to war and they come back and they have PTSD and they don't know how to live in the normal world again. So it can change you in that way. So we have to be aware of that. So how do we recognize? How would the signs of vicarious trauma look? So let's break it up into different areas. The emotional warning signs. You might have feelings of increased sadness, fear, guilt, hopelessness. Cognitive warning signs. Those are your negative thoughts about the world, the future, and your ability to help others. You might start checking out. You might start shutting down. You might start to feel numb. Physical warning signs, chronic exhaustion, aches, pains, getting sick or run down, feeling on edge, unable to relax. Behavioral warning signs, isolating from others, maybe you're avoiding work and responsibilities, you just don't want to do things even as simple as brushing your teeth. Maybe you're unable to listen to others, you're losing your sense of humor, and maybe you feel like you need medications or substances to cope. These are all the signs that we should be aware of. And family members, you may experience some of these signs as well, because you may be taking on the stress of knowing that they're in this traumatic situation. And just being aware of this, maybe you can recognize it in the healthcare worker or be able to recognize it in yourself. And both of those things are really important for us to be able to do. So it's so easy to play up the importance of self-care in our patients and then to downplay it, right, for us. But we cannot do that, because the effects of emotional stress from COVID, it's going to start building up and it's going to start to affect your immune system. It's going to affect your ability to be able to take care of your patients, to provide proper care and make the best decisions from them. It's going to have effects on your family and those around you. You might start to be negative and very stressed at work and spread that around. And of course, all those other risk factors that we spoke about, that increases your vulnerability as well, right? The negative effects of being on the front line, the sense of service, the stigma, the misperceptions, the vicarious trauma. So all of these things make you at a very high risk, and therefore we cannot afford to neglect mental health, and we have to be proactive. So I'm going to delve into our coping skills now. How do we cope with emotional trauma? The very first thing that we have to do is build awareness. So there are ways that we can build these inner resources, and it's going to build our emotional resilience. Now, emotional resilience might not take away the distress that you're feeling during this time, because it is just a stressful time, but it will help you to bounce back and recover after crisis. So first thing, we have to be aware. We have to just meet our basic needs, have a healthy diet, exercise, sleep, to make sure that doesn't affect our immune system. So being very, so consciously making the efforts to eat breakfast, even if it's a granola bar, or take your lunch breaks, and doing some kind of exercise. Getting outside is so important, and getting sleep. And then you have to know your stress signs, right? The ones we just spoke about. And you have to be aware of those, and you have to check in with yourself, monitor yourself, and pace yourself. If you feel like it's getting too overwhelming, figure out where you can go back a little. So that's what it means to pace yourself. And then minimize things that cause distress. If you notice, and so again, you have to be aware of your feeling of distress. Where do you feel it in your body? Does your neck tense up? Maybe you feel tension in your shoulders. Maybe you feel that knot in your stomach, which feels like dread. Maybe you just get this sense of like panic. You have to be aware of your own distress signs and notice, when do they happen? What triggers your distress signs? Maybe it's when you get on social media and you see everyone else, with their families and safe, and maybe that triggers you. Or maybe reading about the news and hearing about how things have been handled. So whatever it is, you have to be aware. And if that's the case, then you have to stop checking your social media, or disconnect from those who are not giving you any positive vibes, or you're not getting any value out of connecting with them at this time. And then you have to stop reading the news that is stressing you out. And the most important thing that you can do with uncomfortable or difficult feelings is feel them. I know that sounds so simple, but most of the time we avoid our difficult feelings because they feel uncomfortable. We don't want to feel them. So we distract ourselves by keeping ourselves busy. Maybe we shut down. Maybe we go numb by watching some mind-numbing TV, which really doesn't re-energize or allow you to feel your feelings. Or maybe we deny our feelings. So we have to be aware that these are unhealthy coping skills. And when we start doing them, we have to be able to stop and acknowledge that this is a difficult feeling. I'm not going to engage in my usual unhealthy coping skill, which just takes me away from my feeling or pushes it down. And again, I just want to review how you would know that you're having these difficult feelings. You can pay attention to your body reactions. Again, maybe your face feels hot. Maybe you're having tightness in your chest, a knot in your stomach, tingling, shoulders are tensing up. So these are just some of the ways that you might feel the distress in your body. And when that happens, we want to stop and again, not engage in that unhealthy coping skill, and acknowledge. We are going to say that I am feeling stressed. I am feeling sad. I am feeling dread about going to work. And then you continue that statement. So you've acknowledged your feeling, you haven't pushed it away. You're naming it, right? I am feeling this dread about going into work. And then you continue. But that's because I'm in a crisis. It does not make me weak. Or I'm feeling this dread of going into work because I don't want to have to see all that suffering again. And that's okay. That's okay that you feel that way. Because of course, it's difficult to deal with suffering. And then you can also do something else to deal with your feelings. It's called strategic venting. And this is where you share with someone who also shares your feelings or can validate for you, like a colleague. Doctors who have done research on this say that though venting is not as focused on solving problems, there are also really positive benefits. Dr. Grice says to get things out in the open and get your feelings heard so that they don't build up and cause stress. So being conscious about who you're going to vent with, right? The best thing would be to vent with a colleague and just get it off your chest, get your feelings heard so that they don't build up. And how do we deal with so much grief and loss throughout the day? Well, it's a similar process in that you're going to acknowledge what happened and process the feelings in the now. Give yourself the time to process the feelings in the now. So maybe you had just had a patient who died, and these are the three things that you can do. You could acknowledge what happened again by saying, I'm feeling so distraught. I'm feeling so much grief right now and so much sadness. I can't believe that this person is gone, that I lost another patient. And then you have to figure out how you're going to feel the grief. What does that mean? It means listening to your body again. Where are you feeling that grief? Is it coming up? And are you feeling like you want to cry? Are you feeling like you just need to sit with it and think about it and think about that person? You might be feeling pain also, and you have to allow yourself to feel that pain as well. And if you don't have the time to do this, then the second thing you could do is you can acknowledge that this is what you're feeling, and then say, I'm going to come back when I do have time and give myself that time to process my feelings. Again, just sit with it or, talk about it with somebody. That's what processing is. So there's a difference between complaining and strategic venting, which is very similar to what you do in therapy. It's like processing, helping you process your emotions. You're not pushing them or avoiding them. You're confronting them in a healthy way. And then lastly, you want to be able to talk to yourself. This is really important because really you're the one who experienced this grief, and you're the one who knows what you need and can be there for yourself intentionally. So you can say that I'm not ignoring the grief that I feel for my patient just because I'm not spending all day thinking about it. I'm just processing it, and I do not need to hold on to it from one patient to another, right? It's okay to let it go. Just like you use sanitizer and decontaminate before you go from one patient room to another, you also have to do that with your emotions. You have to be able to let them go or put them aside for processing later. Because if you do hold on to it, And then you go to your next patient, and then you hold on to it, and you hold on to it, and you hold on to all of this emotion. It starts to build up. So being able to acknowledge and let it go is not ignoring your emotions. And you might feel guilty that how can I just, switch into this other mode where I let go of my grief. And feeling guilty about not holding on to it. But then you just acknowledge that guilt, right? Just say, I'm feeling guilty, and that's okay too. I'm going to try and when I have more time to process it, I'll process it later. Or if you do have time at that time, maybe you go to your break room or somewhere where you feel comfortable, where you're not around people, and you allow yourself to feel the feelings. And again, allowing just means that you're sitting with the feelings and they feel uncomfortable, but you're sitting with them and you're reflecting on them and you're seeing how they feel. You're noticing how they feel in your body. And you're noticing also your thoughts about this. And you're just in it. You're feeling your feelings. That's what that means. So this is how we use mindfulness to process our feelings. We notice, we're awareness, we acknowledge, we name the feeling, and then you sit with the feeling where you're observing it in your body or your mind or your thoughts around it. Here are some other examples of acknowledging and validating statements that might be helpful for you during this time. It's okay to feel worried about catching COVID and worried about giving it to my family. Feeling fear and stress are a normal part of being in crisis mode every day. Yes, it is scary to be around death every day. I am feeling, and the name you're feeling, and that is normal in crisis. But it does not make me weak. I am not alone. Almost everyone impacted by COVID is experiencing these feelings. There's nothing wrong in having these kind of feelings. It is not selfish to feel tired of taking care of people. It doesn't mean that you're going to stop taking care of people, right? You're just tired, and that's okay. So it's okay to feel tired. So I hope you see the difference between acknowledging it and then realizing that just because you're acknowledging it, that doesn't make you a bad person, or it doesn't change your behavior or what you're going to do. No, you're just acknowledging your feeling. It is not selfish to feel drained by being so responsible for so many things. It's not selfish to want to get your negative emotions off your chest. So another tool is, and this tool actually really helps to build emotional resilience, and there is research on it. It's called developing your internal locus of control. Training yourself to take a mindful pause and learning how to, within that pause, tame your emotions so that you don't react. Because, you might react in a panic mode. So if you can, if you feel you've gotten triggered or you're feeling distressed, being able to identify it, take a mindful pause, just breathe, and then figure out a clear way of how you might want to respond. Realizing that maybe reacting in panic is not going to be helpful, and it's not healthy right now. Panic is never healthy. It just leads you to a spiral. So if we can get to a clear mind, at least a space where we are calming our emotions, then we can reflect on what's happening. We can make clear decisions and we can respond instead of react. So the research has shown that in difficult situations where we can't control what happens, people who learn how to control how they respond have more sense of being in control, which improves their attitude and decreases feelings of helplessness and hopelessness. So one specific thing you can do is when life starts to feel out of control, taking the time to reflect on all the decisions that you made starting from when you got out of bed. What did you choose to wear? What did you do after that? What did you eat for breakfast? What texts did you decide to respond to? It may seem simple, but being able to shift this and focus on the choices that you have made shifts your neural patterns from to trauma to building emotional resilience. So another practice, it's called mindfulness, which I mentioned earlier. And mindfulness includes things that we've already talked about, the awareness. And so sometimes you can just take a pause. That helps with being aware and really using your breath. Your breath is there with you at all times. It's there when you're on your way to work. It's there when you're at work. So it is an excellent tool to use. And your breath, if you do intentional breathing exercises, can calm your nervous system down. That is a known fact. It's science. So if, everything that I've told you up till now about how much stress health workers are dealing with, then we have to use our breath very intentionally. Simple breathing exercises, and you can look these up. A box breathing exercise. There's a lot of other exercises that help to calm your nervous system down. And if you can get to know some of these exercises, then that will really help you throughout the day to be able to take this breath and calm your body down so that it doesn't start to react. You're not feeling the stress all the time. You're not feeling distress all the time, and you're not feeling that emotional trauma. And the other thing you can do is cultivate gratitude, right? Throughout the day, maybe just pause and notice the good things that are happening. Maybe some of your stories are very inspirational in that, you thought that they weren't going to come through and then they did come through. Or I read something about this wonderful story about a guy who could not see his wife who had COVID and was in one of the rooms, but she was on the side of a building where there was a window. So every day he would come, he would take the bus, or I think it was like he was 10 miles away, he would either walk but he would every day, he would get to the window and he would hold up a sign telling her that he loves her. So these kind of things also make us realize that there's love, more connection, and more hope during these times when the entire humanity is suffering and struggling. And even through all these challenges, we can notice some of the good things, and that gives us hope. And another part of mindfulness is being kind to yourself. What is okay for you right now? You may need to adjust your expectations, right? Maybe at this time, acknowledging to yourself that all you can do is your best. that you won't be able to help every single person, that you won't be able to heal every single person, that you don't have control. It's not up to you who is going to live and who is going to die, but that you're doing your best and you're providing the care. And maybe at this point in time, your role may be more of a compassionate caretaker, right? Someone who's just there to be there for this patient, because again, the patient doesn't have access to family members. So maybe your role right now is just to be there and not be the helper or fixer. Of course, you're going to try to help and fix, and you're doing the best you can. But then at the end of the day, the most you can do, the best thing you can do is just be there for this patient. Be there with them in the darkness when they're struggling. And maybe you need to give yourself permission during this time. Show yourself some kindness, allowing yourself to cry, to be emotional or not be emotional. There's, nothing wrong with either. Whatever works for you. But you won't appear weak if you do show emotions. You won't appear cold if you don't show emotions, right? But don't forget to share your emotions or process them. We don't want to just keep them in or push them down or deny them. And giving yourself permission to let go of any sense that you have control over the situation. Because you might try to gain control in different aspects of your life, and that might make you feel even more out of control, right? Because the area that you want to have control in, you can't. So it's not about having control or fixing or any of that. It's just about being kind to your patients, showing compassion, and then being kind and compassionate towards yourself. Because we're all in this together and we will get through this together. And so another example I'd like to give you are some self-compassion statements that you can say. I am doing my best. There are many things that are out of my control. I cannot be on 100% of the time. It may not feel like it, but this will come to an end. And part of my job is just to be there for my patient, and that is enough. So build your own confidence by using these self-compassion statements. Come up with your own. You're the only one who knows what you're experiencing. And then don't forget to honor your service. Remind yourself of the noble work that you're doing and recognize your colleagues for their service when possible. It feels good to honor each other's service. Another tool I'd like to give you is how to build a buddy system or support network. And you may have heard this maybe from your supervisors. I know that they're doing this a lot in hospital settings. But if not, you can do this for yourself, right? Talk and connect with colleagues. They're the ones who can validate and normalize your trauma. And share positive stories that evoke hope. And share those with your family members, because sometimes your family members don't know what to talk to you about. Sometimes they're confused as to like, ooh, should I ask? I already know their day was super stressful and they probably don't want to talk about their stress. So let's talk about what was one thing that touched your heart today. So these are things to do. Have these kind of conversations. And access debriefing, supervision, and consultation. Do not be afraid to ask. If you need more consultation or supervision, just to talk with your colleagues on how they're handling it or what to do, or just talk it out, make sure you do that. And then monitor each other's stress. workload, and safety. It is so important for you, all of the healthcare workers, to be able to monitor, oh, it looks like this person's doing a lot more than they can handle, or it looks like that they're not able to handle this amount of work right now. And so bring it up with their supervisor, bring it up with them. It's important that we watch out for each other and keep each other safe during this time. And seek out mental health professionals. You may just feel comfortable talking to them about this. They're the third party neutral person. That's why it's so great to have them around. They know how to listen, how to validate, and then also how to help you build yourself up. So they will give you those skills. And remembering that it's not a sign of weakness to reach out for help, it's actually a sign of strength. It takes more courage to be vulnerable and to acknowledge that you're having difficult feelings or a difficult time. And so that takes more strength. So a couple of tips for families of frontliners. You know, I've been talking to a lot of families of the frontliners, and a lot of them feel very disconnected to their family members who are working in hospitals because they're so busy. They're so stressed out. They feel very worried about them catching it and bringing it home, especially if they have children, young children, and they feel helpless. They feel very helpless. They don't know what to do in the situation. They want to provide support for their family members or and their loved ones, but they don't know how to do that. And so, what are some things that family members can do specifically during this time of high demand and of emotional and mental, like to help the healthcare workers with their mental and emotional well-being? Well, first of all, family members should be mindful that we all manage stress in different ways, right? Depending on the personality of your loved one. If they're an extrovert, maybe they like to share their thoughts and vent and process out loud, or tell you what's happening during their day. But if they're an introvert, they're probably so overwhelmed by having to be an extrovert out in the world and be busy and be on, right, at work, that when they come home, they just want to check out. And it's not an unhealthy checking out they want to do. It's just that they need time away from socializing. They need to be able to go within themselves, because introverts really like to turn inward and really reflect inside. So maybe you have a conversation with your loved one about, hey, what do you think, or how do you manage with stress? And if you don't want me to ask you a billion questions when you come home, that's great. Okay, I can totally do that. But what can we do so that I can at least have a conversation with you? I can at least be there to support you. So sometimes maybe just asking them up front that, hey, this is what I want to do. I want to be there to support you, but I would like you to tell me how, because I really don't know how that would look. So just having that conversation. Helping out with chores and childcare, right? That just what that does is it takes off a huge weight off of healthcare workers, because that's one less thing they have to worry about. And then they can spend that extra time when they come home, spending time with the children, spending time with you. Building a community. Again, maybe asking the healthcare workers, like, hey, why don't we haven't talked to our friend group in a really long time, let's get on a Zoom call, what's a good time? Can we do this at this time? You know, doing a Google Hangout, or FaceTime opportunities with people you know that they really enjoy talking to, people who lift their spirits, who really re-energize them. I think it's important to also figure those things out, right? You might not know what re-energizes them at this time. So again, having that conversation and being like, hey, what are some of those things you think that might re-energize you? Because again, we want to start filling their cup. Knowing the warning signs, right? Of course, that's very important. I went over the warning signs. So if you start to notice that your loved one is acting different, that they're showing more signs of distress, that maybe they are isolating, maybe they are using things to distract and they're not talking about their feelings. I would say the biggest warning sign is a change in behavior. So you know your healthcare worker, your loved one, and if you see a drastic change in their behavior, that would be a warning sign. And again, no need to react and panic. Have a conversation with them. Tell them that these are the things that you're noticing. And I just want to bring it up to you. And I don't know if you've talked to somebody at work, or would you like me to set up a therapy session for you? Or would you like to be able to talk to me? Or, right, just offering some of these suggestions and helping them. And of course, if they're, to the point where they're denying help, you might have to step in and do something. That's why it's so important to know the warning signs, because you also need to know where it's gotten to the point where you feel that you have to step in now and maybe connect them to a mental health professional. Stay at home, right? That just takes that huge weight off of their shoulders of, I know my family is home and I know that they're not going to add to the spread of virus and that they're safe. And so just even staying at home helps. You can also offer well wishes to feel connected. Well wishes are something that you can do yourself. It's like you're sending a well wish of, I hope they have a really good day today. I hope that they have the strength to be able to get through their day. I wish them well, right, for today. So, and you just do this by, again, just being mindful, saying these well wishes out loud to yourself, saying them in your mind. But it really does help to feel connected. You kind of feel like you're doing something. You're like, it's like sending positive energy, right? And then again, you can ask them to share positive stories that evoke hope. Again, maybe having that conversation, because they might not want to share those. So seeing if they're open to sharing that. And some final thoughts, right? So feeling stress in this situation is helpful. It's also motivating to help you to do something and take action. But resist the urge to neglect your self-care. Know your stress signs. And remember that vicarious trauma has nothing to do with you not being strong enough. It's an involuntary response. That means you don't have control in how your body is responding. Just like in PTSD, it's an involuntary response to overwhelming situations. It's not a sign of weakness. Remember, you are not alone, that your colleagues feel the same way. It's okay to reach out for help. Give yourself permission to schedule time for self-care and validate your feelings for yourself like you would for a friend. And lastly, thank you. Thank you so much for everything that you do, for all the sacrifices you do. And I hope that you know that us mental health professionals are here for you. So please, please do reach out. That is something that we can do for you. And that's something that is my role in this situation. So thank you again for everything. And I think now we'll open up for questions.
Thank you, Nermeen. That was an excellent talk. So some of the questions that come in so far, Nermeen, the first question, would you recommend 2 questions I should ask myself after I come home from my shift that will help me recognize how or what I am feeling?
Yes, that's a great question. So maybe you can ask about maybe the question can be, what am I still thinking about from my day? I think realizing that you can, because if you're still thinking about it, you're carrying it on, right? Like you're thinking about it at home and it's still there. So if you're still thinking about it, then you can use some of the practices that we talked about, acknowledging that, okay, there must be a reason why I'm still thinking about this, but it's okay that I'm thinking about this. Can I find another time to think about this? Or yeah, do I want to keep this for another time because I'm home and I want to spend time with my family? So again, once you are aware of what you're thinking about and what you've brought home, then you can acknowledge that emotion, and that helps a lot. And the second thing is, I wouldn't say it's a question. I would say it's kind of like a body scan. And so that's literally like we in mindfulness, we talk about scanning your body. And so just sitting or laying down and closing your eyes. And it's like you're literally imagining that you're scanning your body from top to bottom. So starting with the top, what am I feeling? And noticing as you go down, noticing where you're feeling tension in your body. And being able to, again, acknowledge that you're feeling this tension and just, taking a couple of deep breaths, activating when you take the breaths, activating the hormones that help in decreasing your cortisol levels. And so I think those 2 things would be really great to do.
Well, thank you.
Yeah.
So some other questions, let's actually shift gears a little bit. As a healthcare worker, I am redeployed to a lesser difficult area compared to my peers. I feel a lot of guilt. How can I deal with this?
I can imagine that there are certain ones who are maybe at the front lines, and then the others who are at the back. And I sometimes I've heard that supervisors and managers feel this a lot because they're directing and they know what's happening, and that's super important, but they're not with the patients. And so I think how to deal with that is thinking that, realizing that everything works as a system. So you need the frontliners, and then you need these other layers as well. And maybe if you are not at the front line, what you can do is check in on those who are at the front line, right? Like if you're able to, and you're in that hospital and you're able to check in with them, that would be great. How can you create a support network for them? How can you regularly check in with them? How can you monitor their levels of stress? So it's almost like you could have that sacred job of watching over them because you're in that setting. And if you're not in that setting, you could still figure out a way. Some of the healthcare workers were saying that they're on group text together, and so they check up on each other. So you could create a group text. So I feel like, and then again, of course, acknowledging your guilt. It's okay to feel guilty. I can relate to that as well. I mean, that's why I feel guilt, because I feel that how can I help those in the front line? I literally want to do therapy with them, but I know that that's not something I can do. But at this point, what can I do? How can I watch out for them? How can I monitor? How can I share my knowledge and information? You can even, so even just sharing this knowledge and information, and if you're able to create anything from this, that's also helping. So.
Excellent. Well, next question we received, how do you suggest I share my feelings of fear of bringing COVID-19 home with my young children who don't understand?
There are a lot of excellent articles about how to share this information with kids, but honestly, from a parent, mindfulness parenting aspect, I always say that just being very honest with them. You would be so surprised at children's ability to understand. They can sense what's happening. And they're probably scared about that too. And if you have young children, I would say like, 5 to 7 and younger, if they haven't asked you, or, if they're not actively feeling anxious about it all the time, then maybe you don't need to actively bring it up. But if you have older children who are afraid, don't be afraid to have those conversations with them. Don't be afraid to bring it up with them, to bring up your own fears. But then also, you could use some of these techniques we discussed, right? So you discuss the fears, you acknowledge, and then you help them to come up with those self-statements, those very empowering self-compassion statements, or any of those other statements that help us through help us dealing with this anxiety, right? So that we're not just focusing on the fear and the anxiety, but we're also we are acknowledging it, but we're also coming up with ways on how we can dispute it and use, counteract some of that fear and anxiety with the self-compassion statements.
So let's extend that a little bit. We're getting multiple questions about what about our family members, adult family members now, who are anxious about the fact we are on the front lines. What would you say to them?
First of all, finding out where are they getting their information from. A lot of times I've heard that those adult family members are, watching the news constantly, and so that is just building up their fear, especially if they have, a child who is working on the front line. So maybe also sharing some of these techniques with them of like, hey, if that's causing you distress and you're like thinking about it all the time, why don't you minimize watching the news? Or why don't you just listen to one news? And then you can also tell them that, hey, if you're afraid, talk to me and ask me, what am I doing? I will reassure you that I am wearing, my mask, everything. I am being very careful every day. I'm washing my hands. I'm doing this. And that this is the situation. So it's a very, again, helping them to acknowledge that this is a situation. I am in this profession. It is my time to stand up. I understand that you're afraid, right? So acknowledging them too, that's very, very helpful. And then just reassuring them and telling them that, hey, whenever you're afraid, just let me know, or text me. But you have to set that boundary if they start going in panic, kind of panicking every day, checking in, then you do have to set boundaries. So you might want to also consider that.
Thank you.
Mm-hmm.
Shifting gears a little bit again. So for families of healthcare workers who are currently quarantining themselves outside the home, how can those families support those healthcare workers?
As much as you can, having that connection, doing those FaceTimes. If you have children, you can have them draw things and send them texts of like, oh, so-and-so drew this today for you. You can also send them like lunches to where they're at, or, maybe drop off food or, something. And then you can create like fun ways. You could play a game via, online. There's a lot of online board games. You can also share what you've been doing, more pictures, more connection. Those kind of things are really important. So that's, and like I said, the thing I really liked was that even sharing, somehow if you can get them some home cooked food. I know a lot of the healthcare workers that I spoke with were like, that is something that I love. That is just something that when I get home cooked food, it makes their day, right? Like it really, again, fills their cup. So if you can do things like that, and then you can ask them, right? Like, hey, what can I do? Use this analogy of the filling the cup. Like, I feel like I can't do anything from home. Can I drop something off food, or can I do something else for you? Or can I drop a book off? Or can we FaceTime more?
Well, thank you. Well, thank you everyone for joining us today. We hope you appreciated and enjoyed this session. The recording for this session will be on akhp.theismailiusa.org within a couple of days. And that website also contains many other resources of COVID-19 and all of our previous Grand Rounds recordings. Once again, thank you for joining us tonight. Have a good night.